Good morning, everybody. Our today's lecture is on the anatomy of heart, part second. The learning objectives for this session are: at the end of this session, students should be able to describe heart under following headings. They should be able to enumerate chambers of heart, describe exterior and interior of the right atrium. Descriptions of anatomical specimens at the end of this session will cover dissection part of heart. Heart is a four-chamber muscular pump located in middle mediastinum. It beats throughout life of an individual without getting exhausted as cardiac muscle relaxes during diastole. It receives blood by superior and inferior vena cava during diastole and ejects the same into systemic and pulmonary circulation during systole. Heart beats at the rate of 70 per minute and pumps about 5 liters of blood per minute into systemic circulation. Right atrium. Right and left atrium together form base of heart, which is directed opposite to the apex, that is upwards, backwards and to the right, and lies in the second intercostal space. This space marks the upper limit of cardiac dullness on percussion. Importance of right atrium. As already said, right atrium receives venous blood from all parts of the body by superior and inferior vena cava. Right atrium also receives the venous blood of heart, which is drained by coronary sinus and other veins into right atrium. Blood from right atrium enters into right ventricle by tricuspid opening, which is guarded by tricuspid valve. Most of the blood passes from right atrium to right ventricle passively, but its contractions do contribute to the filling of right ventricle during diastole. Interior of the right atrium is clinically important for cardiologists for performing interventional procedures like manipulating pacemaker leads and performing ablation procedures. Topography of the right atrium. Right atrium and left atrium form anatomical base of the heart, but the interatrial septum is obliquely placed in such a way that most of the right atrium faces anteriorly and forms the right border and also contributes to the anterior surface of heart. Topography of right atrium. Right atrium and left atrium form anatomical base of the heart, but most of the right atrium faces anteriorly and forms right border. It also contributes to sternocostal surface of heart, whereas left atrium faces posteriorly and to the left, it predominantly forms base of heart as shown in this figure. In this diagram, you can see the anterior view of the right atrium, where right atrium forms the right border of the heart. It also contributes to the sternocostal surface. It receives superior vena cava, inferior vena cava, and right auricle projects from the right atrium as shown by this arrow. On viewing the heart posteriorly, we see that the left atrium contributes to majority of the anatomical base of the heart. It drains four pulmonary veins and predominantly forms base of the heart. The only part of the left atrium which is visible on the sternocostal surface is left auricle. External features of right atrium. The superior vena cava enters the upper posterior portion of right atrium, and the inferior vena cava and coronary sinus enter the lower posterior portion of the right atrium. What is sulcus terminalis cordis? It is a groove which extends from the right side of the opening of superior vena cava to the right side of opening of inferior vena cava externally on the surface of the right atrium. Internally, this division is indicated by crista terminalis that begins on the roof of the atrium just in front of opening of inferior vena cava and extends down the lateral wall to the anterior lip of inferior vena cava as shown by this black dotted line. Division of right atrium. Interior of the right atrium is divided into two parts by presence of a vertical groove on the outside along the right border of the heart termed as sulcus terminalis, indentation of which is present on the inside as a ridge termed as crista terminalis. Thus, crista terminalis divides right atrium into rough anterior part termed as atrium proper with musculi pectinati. Number 2, smooth posterior part termed as sinus venarium. Third part, which consists of opening of superior and inferior vena cava, coronary sinus, foramen venarium minimarium and intravenous tubercle. To see the interior of right atrium, give an incision along the sulcus terminalis. This divides the interior into two parts, smooth posterior part and rough anterior part, as shown in this figure. For the purpose of description, interior of the right atrium is divided into three parts, as shown in this diagram. What are the various openings inside right atrium? There is opening of superior vena cava, opening of inferior vena cava, tricuspid opening or right atrioventricular opening through which blood passes from the right atrium into right ventricle. There is opening of coronary sinus. Coronary sinus drains the whole venous blood of the heart except that drained by the anterior cardiac veins and vena cava minimi. And features of smooth part of sinus venereum. Opening of inferior vena cava is situated below and posterior. This opening is guarded by a rudimentary semilunar valve which is derived from right venous valve. It is also called eustachian valve. The importance of this valve lies in the fact that it directs the blood to left through foramen ovale during fetal life. Opening of coronary sinus lies between the opening of inferior vena cava and tricuspid valve. This opening is also guarded by a rudimentary semilunar valve. This valve is called Thebesian valve and is derived from right venous valve. AV node is situated just above this valve in the triangle of Koch. As shown in this diagram, this opening lies between the openings of inferior vena cava, which is marked by this red circle, and the opening of the tricuspid valve, as shown in this figure. So there are three openings. Blue one is opening of coronary sinus. Red one, which is small in size, is opening of inferior vena cava, and the large red one is opening of the tricuspid valve. Between these openings lies the opening of the coronary sinus. Coronary sinus is the largest vein of the heart. It drains venous blood from all parts of the heart except those parts which are drained directly by anterior cardiac vein and vena cava minimi. Now, what is foramen venereum minimarum? Numerous openings of vena cava minimi, also called the Thebesian veins, also open directly into the right atrium. Anterior cardiac vein may also open directly into the right atrium bypassing coronary sinus. The openings of these small veins and openings of anterior cardiac veins are seen inside the right atrium. Right atrium, in addition to the major openings of superior vena cava, inferior vena cava, coronary sinus, and tricuspid valve. Now, what is the orientation of interatrial septum? Right and left atria are separated by an interatrial septum. This septum is obliquely placed in such a way that right atrium faces anteriorly and contributes to the formation of anterior surface of and also the formation of right quarter of the heart, whereas the left atrium faces posteriorly and forms base of the heart, as shown in this figure. The only part of left atrium visible on anterior surface is left auricle. What is intravenous tubercle of lower? The intravenous tubercle of lower is a small projection on the posterior wall of the right atrium above the fossa ovalis. It is distinct in the hearts of the quadrupeds, but in man is scarcely visible. It was supposed by Lower to direct the blood from superior vena cava towards the atrioventricular opening, top part of right atrium. This part of right atrium is derived from primitive atrium. Crista terminalis is a smooth muscle ridge present at the junction of smooth and rough part and extends from upper part to lower part via superior vena cava opening up to the valve of inferior vena cava, as shown by this dotted black line. Crista terminalis separates smooth part from anteriorly placed rough part of right atrium. It corresponds to sulcus terminalis on the external surface. It develops from upper part of right venous valve. What are musculi pectinati? A series of transverse ridges of muscles passing from crista terminalis downwards and forwards towards the atrioventricular orifice like the teeth of a comb. As shown in this figure, crista terminalis forms the base of this comb and emerging from the base are teeth-like muscle fibers. We call them as musculi pectinati because they resemble the teeth of comb. What are the features of interatrial septum on right side? The features of interatrial septum seen on the right side are: there is an oval depression in the lower part of the septum above and to the left of inferior vena cava opening, as shown by this encircled white area called fossa ovalis. The fossa ovalis is formed by the septum primum. Now, what is limbus fossa ovalis? It is also called annular ovalis. It is a prominent margin surrounding above and on sides of fossa ovalis but deficient below. It is continuous with value of inferior vena cava. Limbus fossa ovalis represents free ventral margin of septum secundum. Let us recap the features of interatrial septum in this diagram. So interatrial septum presents fossa ovalis. Above the fossa ovalis is limbus fossa ovalis. Inferior vena cava opening into right atrium is guarded by eustachian valve. This opening of the coronary sinus, which lies between the opening of inferior vena cava and opening of tricuspid valve. This opening is guarded by Thebesian valve as shown in this diagram. This is tendon of Todaro. Tendon of Todaro connects the central fibrous body of the heart with the valve of inferior vena cava. It is located subendocardially. What is triangle of Koch? Koch's triangle, named after the German pathologist and cardiologist Walter Koch. It is an anatomical area located in the superficial paraseptal endocardium of the right atrium. Its boundaries are the coronary sinus orifice, the tendon of Todaro, and the septal leaflet of right atrioventricular valve. What is location of triangle of Koch? Triangle of Koch is defined by the ostium of the coronary sinus posteriorly, septal cusp of tricuspid valve anteriorly, the tendon of Todaro posteriorly. Tendon of Todaro is a tendinous structure connecting the valve of the inferior vena cava ostium to the central fibrous body of heart. It is used as an anatomical landmark for location of AV node during electrophysiology procedures such as pacing and ablation. Membranous part of AV septum lies just caudal to AV node. As shown in this diagram, the boundaries of Koch's triangle are septal cusp of tricuspid valve anteriorly, tendon of Todaro posteriorly. Third boundary is formed by the Thebesian valve posteriorly. Between these boundaries lies the subendocardial area called triangle of Koch. This triangle of Koch is important clinically because it contains AV node. Tricuspid valve is a communication between the right atrium and the right ventricle. This valve is guarded by three cusps. They are named as anterior, posterior cusp is also called inferior, and septal. These cusps allow unidirectional flow of the blood from right atrium into right ventricle but does not allow blood to flow in reverse direction unless these cusps are damaged. What is right radiological border of the heart? Right atrium also contributes to the formation of right radiological border of the heart. This border of the heart on X-ray is formed by superior vena cava, right atrium, and inferior vena cava. So in contrast to the right anatomical border of the heart, which is formed by the right atrium, right radiological border of the heart is formed by superior vena cava, right atrium, and inferior vena cava. Radiological base of the heart rests on the left dome of the diaphragm, whereas anatomical base of the heart rests in the second intercostal space. Let us go for a brief description of left atrium. Left atrium predominantly forms base of heart with a minor contribution from the right atrium, as shown in this figure. This left atrium faces posteriorly. It receives four pulmonary veins, whereas right atrium forms the right border of the heart and faces anteriorly. The only part of the left atrium which forms the sternocostal surface of the heart is left auricle. It is directed upwards, backwards, and medially. Four pulmonary veins open into it. It communicates with the left ventricle through mitral valve, which is a bicuspid valve. It is separated from diaphragmatic surface of the heart by coronary sulcus containing coronary sinus, which is the largest vein of the heart. Left atrium is important clinically because it is related to esophagus, which is a content of posterior mediastinum. To cover the dissection part of the session, let's identify anatomical structures in these wet specimens. This is a wet specimen of the heart. In this specimen, A is ascending aorta, B is fossa ovalis, C represents opening of coronary sinus, D represents opening of inferior vena cava. In this specimen, A represents superior vena cava, B is right atrium, which is placed anteriorly and forms part of the sternocostal surface of the heart. C represents the atrioventricular groove. This groove lodges right coronary artery. And D represents base of the heart, which is formed by the left atrium. There are openings of four pulmonary veins. This atrium is related posteriorly to the esophagus. These yellow dotted circles are openings of four pulmonary veins. Again, this is the posterior view of the heart. In this view, we can see pulmonary trunk dividing into right and left pulmonary arteries. In this specimen, A represents pulmonary trunk dividing into right and left pulmonary arteries. B represents one of the four pulmonary veins opening into the left atrium. C represents superior vena cava opening into right atrium, and D represents inferior vena cava again opening into the right atrium. In this wet specimen, A represents right atrium forming the sternocostal surface of the heart. B represents ascending aorta. See, this ascending aorta lies posterior to the pulmonary trunk. Its wall is thicker than that of the pulmonary trunk. C represents pulmonary trunk which originates from right ventricle. It lies anterior to aorta and has thinner wall as it pumps blood into pulmonic circulation in contrast to aorta which pumps blood into systemic circulation. D represents atrioventricular groove with right coronary artery and its branch. E represents anterior interventricular groove containing left anterior descending coronary artery. In this wet specimen, A represents atrioventricular groove, B represents superior vena cava opening into right atrium, C represents descending aorta, D represents pulmonary trunk. Again, we can see the relation between aorta and pulmonary trunk. Aorta lies posterior to the pulmonary trunk. It is thick-walled in contrast to the pulmonary trunk. Again, in this wet specimen, A represents tricuspid valve. This valve is guarded by three cusps. They are named anterior, posterior. Posterior is also called inferior, and septum. B represents superior vena cava opening inside right atrium. C represents pulmonary trunk, and D represents fossa ovalis. Fossa ovalis is a remnant of septum primum. In this wet specimen, A represents base of the heart. This anatomical base of the heart, which is formed mainly by the left atrium. It receives openings of four pulmonary veins. B is atrioventricular groove. B represents coronary sulcus. This sulcus contains coronary sinus, which is the largest vein of the heart. C represents posterior interventricular sulcus. This posterior interventricular sulcus separates right and left ventricles posteriorly. It lodges dominant coronary artery. Dominant coronary artery is the vessel which occupies the posterior interventricular sulcus. It can be branched from the right or left coronary artery. And D represents superior vena cava opening inside right atrium. Let us go for a quiz based on this lecture. You will be provided an MCQ with four options. You have to choose the most accurate one. Our first question is, which of the following structures predominantly forms base of heart? A. Right atrium. B. Left atrium. C. Right ventricle. D. Left ventricle. B is the correct option. Which of the following statements is follow about tendon of Todaro? A. It is subendocardial tendon. B. Connects central fibrous body of heart with Eustachian valve. C. It forms posterior border of triangle of Koch. D. Thebesian valve forms it is anterior boundary. D is the wrong option. Which of the following statements is follows about boundaries of Koch's triangle? It is bounded by septal cusp. B. Contains AV node. C. Tendon of Todaro forms it is posterior border. D. Thebesian valve forms it is anterior boundary. D is the wrong option. Which of the following forms the right border of heart? Right atrium. B. Left atrium. C. Right ventricle. D. Left ventricle. The right border of heart is formed by right atrium. Which of the following does not form boundary of triangle of Koch? Tendon of Todaro, septal cusp of tricuspid valve. C is Thebesian valve. D is coronary sinus. Coronary sinus is the wrong option. Which of the following does not open in the right atrium directly? Superior vena cava, middle cardiac vein. C is coronary sinus. D is anterior cardiac vein. Middle cardiac vein is a tributary of coronary sinus. It does not open directly into the right atrium. Which of the following is a content of triangle of Koch? AV node, tendon of Todaro, bundle of His. D is SA node. Correct option is A. AV node is a content of triangle of Koch. And importance of triangle of Koch lies in the fact this triangle is used during ablation procedures. Our next question is, Eustachian valve guards which vessel? Superior vena cava, inferior vena cava, coronary sinus, great cardiac vein. Superior vena cava is valveless. Inferior vena cava is guarded by Eustachian valve. The valve of coronary sinus is called Thebesian valve. So B is the correct option. Tibetan valve goddess which vessel? Superior vena cava, inferior vena cava, coronary sinus, great chordic vein. C is the correct option. Our last question is which of the following is not true about fossa valis? It is bounded by limbus fossa valis anteriorly. B. It is formed by septum secundum. C. It is papery thin. D. It is surrounded by limbus fossa valis superiorly. B is the wrong option. It is formed by septum primum, not septum secundum. Do not forget to like, subscribe and share this video. Thank you for watching.